My name is Tanner. I'm currently a graduate student at the University of Texas at San Antonio, getting my master's in mental health counseling. Right now, I'm doing my second of 3 counseling internships. So I'm seeing clients at UTSA's Counseling Center. Prior to beginning graduate school at UTSA, I had struggled with both obsessive compulsive disorder and anxiety symptoms for pretty much my entire life.
Okay, so here is another person talking about ketogenic diet and OCD. So, yeah, it's I have agoraphobia, chronic OCD, depression, anxiety. I'm about what would I be? Maybe 2 months into ketogenic therapy. But I will admit that sometimes I have eaten over 20 grams of carbs. So I haven't been in ketosis the whole time, I'm sure. My keto mojo keeps breaking for some reason, so they keep having to send me new ones. And since they're sending it from Germany, I think, and I'm in Ireland, it takes like a week to get here. So I haven't actually been able to test my ketones as much as I'd like because they sent me a replacement keto mojo and that one was broken. So then they're sending me another one. So anyway, but all in all, it's been about 2 months since I've had any sort of refined sugar, refined carbohydrates. On the days where I did eat over 20 grams of carbohydrates, it would have been like potatoes or my homemade bread that I make myself from organic wheat and basically just organic wheat, water and salt. I put it in a bread maker and it makes it. Um, and yeah, I have noticed effects from that, especially when it comes to itching at night, my eczema and things like that. Like I've definitely noticed that at night, then I'll start to really be like scratching a lot. I've also noticed that I really have to like just not have dairy at all because I was putting cheese um into my ground beef and like with a clean tomato sauce, and it was just kind of messing with my stomach. So I've stopped eating cheese and stuff now as well. I do have occasional kind of spoonfuls of butter on top of some meat, fatty meat, but that's the only dairy I'm having, and it's definitely my stomach is better after that. But when it comes to my OCD, yeah, for the most part, I'm starting to see it kick in now, and I don't know. I honestly don't know if it's the ketogenic therapy or if it's just the fact that I have, had absolutely no ultra processed foods or sugars or anything like that in 2 months, and I'm just less inflamed than I would have been. I don't know. I think it's probably a combination of all of the things, and it's too difficult to test because on the days when I do eat, I have eaten over 20 grams of carbs. I'm also, those days when I feel like eating carbs is usually because I'm in the luteal phase of my cycle, and I'm kind of in the week before my period and I want to eat more, so I eat more and I eat more carbs because I want them. And as long as it's whole foods, I'm not going to deny myself anything because I want this to be sustainable. And as long as I stay away from ultra processed foods and eat a clean whole foods diet, I don't really care how much I eat. And obviously, to be in ketogenic therapy, you have to be under 20 grams of carbs. But I am starting now to lift more and do more weights and strength training. And hopefully, that will burn off any excess carbs that I do eat. But like I said, I can't really test at the moment, so I don't know. I definitely feel better. I got my period like last week, and basically, I didn't notice any spike in my usual horribleness that I have the week before. So that, and actually, I wasn't as hungry either because I didn't have any kind of days where I ate loads. So, um, yeah, it definitely works. I mean, it there is something to it. I would suggest it because I did know from going carnivore before, and I've talked about it in a previous video. It definitely helped my OCD symptoms when I was a couple of months in to being extremely low carb or carnivore. It definitely did. It's well worth looking into if you have OCD, because even though I still get thoughts, the thoughts that would have sent me into a spiral before, like I can just go, oh fuck off. I'm not entertaining this bullshit today. Like I'm not interested in you. Go away. And when I eat like sugar, well, I know like when I eat sugar and stuff for a couple of days, like if I get that thought, I ruminate in it. I can't tell it to fuck off. But you're able to just kind of go like, I'm not interested in you. You're just bullshit. Go away. That kind of being able to do that is why I stick on the low carb diet and try to eat clean all the time. So I always had this kind of day every 10 days where I'd binge on crappy stuff and and ultra processed food and sugars and stuff. So I haven't done that for over 2 months and it's definitely working. So even if it's not always under 20 grams, it's always clean whole foods. But most of the time I am on like under 20 grams of carbs a day. But anyway, let's listen to this guy's story.
The symptoms were very debilitating. I would spend multiple hours per day obsessing about a variety of things and completing both physical and verbal compulsions.
Oh God, I remember those days. Horrible, horrible way to live.
So it got to a point where it really had taken over my entire life until I discovered metabolic therapies. And after I implemented a handful of metabolic therapies, I really just regained control over my life. And honestly, when I talk about it with people, I kind of explain that I was like reborn in a sense. Like I'm a completely different person. And almost every single day, I think of like pre-keto and post-keto. That's kind of how I like frame my life today, like a before and after lens. I implemented like a number of metabolic therapies. Obviously, the primary one was a ketogenic diet. And about 6 weeks in following these metabolic therapies very strictly, it was like one day I just like woke up and everything had like clicked into place. Like the internal chatter came to a halt. The anxiety pretty much evaporated. Resisting those like physical and verbal compulsions just became effortless, whereas before it was just so challenging. My confidence.
Imagine being able to resist your compulsions being effortless. Like if that's not a reason to try this, you don't have OCD, because anybody who truly has OCD hearing something like that will go, I have got to fucking try this because I'm literally driving myself demented every single day of my life. And this is the reason why I tried these kind of stories. You're just like, but then at the same time, be careful and don't do what I did last year when I went carnivore and start comparing yourself to everybody. And why is this guy like, this is a bit of a clickbaity thing. And I do think I'm a bit surprised by Metabolic Mind because they should be a bit more careful. 6 weeks to silence. Like, but they do say quieted my OCD. They're not saying that this guy doesn't have the thoughts. He's just able to basically tell the thoughts, not interested in you. So, I was kind of like, why is this person cured in 6 weeks and I'm not cured in 6 weeks? What am I doing wrong? Is it a waste of time? Is it not working for me? There's so much clickbait on there. So you have to be careful of that and do it. That's why I'm trying to find something that's sustainable long term and just find what works for me. It is a big part of experimentation. Um, but, like you've just got to find what works for you. I am though from now on. I am going to really, because I've done in the other metabolic things, like I wear the glasses to block the blue light at night. I get enough sleep. I get sunlight in the morning. I get a lot of sunlight actually. I'm outside in the garden a lot during the day to get as much sunlight as I can. I I exercise pretty much every day. I will do some form of exercise. Well, every day I do exercise because I walk a lot, but like I said, I'm starting more hard strength training and I jog, and it's all of the things. And also I try to be grateful for remind myself to be grateful for the good things that are in my life. And you have to have a purpose in your life as well. And unfortunately, my mom now is going to need an operation and things. So I am a carer for my father, and it looks like I'm going to end up having to take more responsibility to care for my mother as well. And that's, like something that happens when you're in your 40s and your parents are getting older. But, that gives me a purpose because I don't have kids of my own, and I don't really have anything outside of my two dogs to take care of. So, helping my family out is a purpose for me, and that's some you need that. Like you need something outside yourself to think about, especially if you've got depression. You need something outside of yourself to have to care for, um, because otherwise you just won't bother getting out of bed. If it's just about you, you're not going to care. You're just not going to get out of bed. So you need something. Um, and anyway,
Skyrocketed. My presence skyrocketed. I think like up and I think up until that point, like I didn't really understand what it was like to be present. Like being present was like a very small minority of my life. Like I just didn't have a lot of experience doing that. My head was always somewhere else. And so that was very new for me. I just can't express like how much my life changed, honestly. Like there's just not words to express it. I think like one challenge, probably the biggest one, was the learning curve. I always tell people like before I went down this rabbit hole, like I didn't know the difference between a calorie or a carbohydrate. I just knew they were both nutrition related and started with the letter C. So I had zero knowledge whatsoever. Now, thankfully, I was in a position where I could take a few months off of work. I had saved up quite a bit of money, and essentially get like, a college degree in like the ketogenic diet, right? Like it was like a full-time job for me for multiple weeks where all I was doing day in and day out was learning everything I could about the ketogenic diet and everything I could about other metabolic therapies. And so I recognize that can be a real challenge for people. Like there is just so much to learn. I think as
yeah, but there's so many YouTube videos. Like, there's so many books now. There's so many people you can go to. Like, what I do is I just stick the earbuds in while I'm walking around the garden trying to get my sunlight, and I listen to people talk about this on YouTube. And I just like listen to it as I'm outside with my dogs. You know, um, that's how I've learned. And like I said before in previous videos, like I was doing the fasting and the exercising on an empty stomach, thinking, and then you discover somebody new who tells you, no, actually, you're a 44-year-old woman. You should not be doing that. That does not help you. And then you learn something new, and the information's always changing, and there's a lot of it, and it's confusing and it's annoying, and sometimes you just go like, what are we doing here? Like, now I have to worry about this thing as well as that thing. But like, you've got to find what works for you, because there are plenty of women who have things like bipolar and stuff who are on these these channels talking about how fasting, long fasts, have changed their life, and they think it's because it's the mitophagy, reproducing the mitochondria, gave them all healthy mitochondria again, and that's a, but like when I look at these women are in their 30s. So like, you've got to say, like, hormonally, what age are you hormonally, especially if you're a woman. So then you learn about that. So you've got to do your own research, but you've also got to trial and error. And but I guarantee you, one thing I can guarantee you is that if you cut out ultra processed food, then by default you are cutting out refined sugar from your diet. If you eat a whole foods diet, okay, you mightn't be cured of your mental health problems, but you are going to feel a hell of a lot better if you just cut out ultra processed foods and eat, well, for me, eating fatty meat and cooking with animal fat instead of fucking cooking with seed oils. But if you eat a high fat diet, or if you just cut out if you just have a whole foods diet and you cut out, you're automatically eliminating the emulsifiers, which fucks up your microbiome. You're also automatically cutting out refined sugar, which just inflames the crap out of you. So even if you just do that, like, I guarantee you're going to feel better after a couple of weeks. But yeah, you'll probably go through some withdrawals first, but you will feel better in the end.
second challenge that I faced during this journey was surprisingly how unsupportive some people can be when you try an untraditional treatment method. You're met with a lot of doubt, which I can understand, right? If you're not familiar with a ketogenic diet as a medical treatment, I can understand why you would be doubtful, but also resistance, right? Like a lot of like judgment, this sort of like in group, out group dynamic where I'm still eating sugar and ultra processed foods and you're not. And so are you judging me? So
Okay, so I've said many times how wonderful and supportive my family are, and they do wish the best for me. But when they don't see me progressing to the point that they would like, sometimes, and I say, like, oh, something about food, they will say, well, obviously that's not true because you aren't like outside every day socializing and making friends and stuff. But anybody with OCD will know that there's what goes on inside your head and there's what people think goes on inside your head or what they can see. And when I try to explain that just because I'm not outside socializing all the time does not mean that the diet hasn't significantly made a difference inside my own brain, inside my own mind, my thoughts, my obsessions. Like, you don't understand what pure OCD is. Like, I can see a significant change in my own body, in my own thought process. You wouldn't be able to see that. Like, your biometric of how cured I am is whether or not I can go to the supermarket once a week. And I understand that because you don't fully get it. And I should be able to go to the supermarket once a week, and hopefully I will someday. But that doesn't mean that it's not working. It just means you don't see the results you expect. But you have no idea what it's like to be trapped inside your own head 24 hours a day. You have no idea what it's like to want to jump out of your own skin from anxiety when you're sitting in the comfort of your own home. Like, this is what people are dealing with that you don't see. So, like, we notice the difference when we go onto these diets, when we cut out these crappy foods, when we exercise more, when we get better sleep, when we get sunlight. Like, we see it. So I love my family and they're so supportive and everything like that. But sometimes they'll come out with a comment and I'm just like, fuck you. Like, just, I'm sick. Like, you know what? You do you. You think what you want to think. And even now, like, one of them is saying to me, like, you're becoming OCD about food because I won't eat crap. And I'm saying, maybe I am. Maybe I'm, because I'm a neurotic person. Maybe I'm neurotic about it. But I keep, every time I have broken it before. Every time I have eaten the crap, I have fucking, and it's not neurotic when it's an obsessive thought. Because I know the difference between dwelling on something and putting the idea in my own head and actually not being able to fucking get rid of the idea. I know the difference because one is controllable and the other one is not. So I know the difference. I've been dealing with this shit for 20 years. And actually the reason why I started ketogenic therapy 2 months ago was because in a conversation with my mother, and she just basically went like, it's all just nonsense. It doesn't work. The whole diet thing doesn't work. And I got so pissed off that I thought, right, fuck you. I'm gonna show you. Because in a couple of months I'm gonna be outside with the dogs and I'm gonna be at the beach and I'm gonna be walking my dogs and I'll fucking show you. And I know that's a stupid reason to do, but sometimes if that's your motivation, who cares? Take your motivation where you can get it. But I am going out more. And actually, I have decided as well that I am sick of Prozac. I am sick of being emotionally detached from my own life. I know that's part depression, but I also know that that is fueled by the Prozac. And I want to come off it. So I have made a deal with myself that if I'm able to go out every day, get in the car and go out, like somebody else is driving me, but just at least get in the car every day and go out for a solid month, for 1 month straight, 30 days, whatever. Then I'm going to very slowly start to taper off my Prozac because I know it does not help me with my motivation to actually push myself to go out and to test this new level of not having anxiety that I have. Because when I go out, I don't really have that much anxiety, but I can't be arsed to actually get ready to go out in the first place. So um, I know that Prozac doesn't help with that. So if I can get myself out, so I only actually started this yesterday. So I went out yesterday, and I have to go out again today. And if I can do that for 30 days, then I'm going to very, very slowly start to take myself off the Prozac. I'm going to do it extremely slowly because I can't afford to have anxieties and stuff like that come back because I do have to care for my parents, so I can't afford. So it'll be a very, very slow process, but yeah, I am going to start doing that.
I think just like a lot of the conflicts I faced with family members and peers was challenging. But to be honest, it was just absolutely so worth it. Like,
Yeah, that's another thing. So that was at the beginning 2 months ago when I started it, and then a couple of weeks into it, I was thinking about how angry I was at my mother, and when somebody makes a comment, and how angry I used to get, and I just realized, like, in the most respectful way, I don't really give a shit what your opinion is because I know, I can feel it. Like, my head is quieter, my head is better. I'm going out more than I ever have. Yeah, I still have weeks where I might go not go out for a week, and then yeah, I'm not perfect, I'm not cured, I'm not anything, but I am better. I feel fucking better. And do you know what? Like, who gives a shit what people say? Like, it can be demoralizing, but like, when you know in your when your head is quieter, when you're able to tell OCD to go and fuck itself, I am not entertaining you today, and then just get on with your day. Like, does it really matter what somebody else says to you? If somebody else is trying to force fucking shit down your throat and trying to force you to eat crap because they are, then that's a problem. That person needs to be told where to go. Like, you can't, you like, you do what you want, but don't try and force me into eating what you eat. Like, as long as nobody's being like fucking horrible like that, then who cares what their comments are? Because you know. And I'm at that stage now because I'm 2 months in, and I'm like, do you know what? They mean well. They're just, they're worried about me, but I will prove, I will prove myself right, and they will see, and all they're going to be is happy that I'm enjoying my life more. Like, I know that. None of them are like trying to force me to eat crap. They're just kind of saying, like, maybe I'm putting too much hope into this therapy. That's really where they're coming from. If they were trying to force me to eat crap, I'd be like, I'd have a different attitude towards it.
I would never change my decision. It was just so obviously worth it. If somebody came to me and said, why should I try a ketogenic diet when I could just take a medication? Like, what would I say? I think like I would base my answer to that question off of my own experience with medication, which was a poor one. I tried a couple of different medications roughly about 10 years ago. And not only did I not see a lot of improvements, I experienced I ever had was right after I started taking medications. And then it got to a point where I was too afraid to do anything really, to leave my home really, because I was afraid I was going to have more panic attacks. And my
So that's basically what happened to me. But I actually got the panic attacks before I started taking the medication. I'm not anti medication. I do think that the medications can help, especially if you are at the point where you are just getting panic attacks in your own home for no reason. Like, at least with the agoraphobia, I know it's because of when I go out, but at least since I went on the medications, I can, or especially like with Prozac, I can have some peace in my own fucking home at least. But there are side effects to it that are, debilitating in other ways. So you weigh up the pros and cons. Complete emotional detachment from life versus having panic attacks in my own house. I chose the emotional detachment from my life for the bit of peace that I get. Um, but the idea that what he's saying, where his whole life became about not having a panic attack, that's the reason why I'm agoraphobic. That's the reason why I have OCD. well, no, I always had OCD before, but like this is the reason why my OCD got so out of control, because everything was about trying to say, like, if I do this, I won't have a panic attack. If I do this, I won't have a panic attack. And then I just became like housebound agoraphobic from that in the end. And if I was going out, I would have 4 hours of OCD preparation before I could leave my house. And even at that, the whole time, I'm suppressing panic attacks and trying to deep breathe and trying to, and doing OCD things in the car, doing OCD things when I'm in the supermarket, so that I'm like, if I don't do this, I'm going to have a panic attack right now. And like that's the reality of it. And medication, which I tried a lot of different medications, they never stopped that when I actually went out. So medications can give you a bit of relief, but they do not cure. Like maybe some people get completely cured from popping a pill with no adverse side effects, but I mean, come on, how many people do you actually know like that?
Life revolved around avoiding panic attacks, right? So obviously, panic attacks are one of many side effects that psychiatric drugs can cause. And I will acknowledge, like, I am aware of people who take psychiatric drugs and have a lot of success with them. But at least from my anecdotal experience, that success is not long lasting. So with the ketogenic diet, maybe other than some diarrhea, I didn't really have any side effects, and the success has been long lasting. Honestly, I'm about 2 years in at this point, and I still feel just as good as I did on day one, right? And it's just a lot easier than taking a drug, I guess, right? I have total autonomy.
Yeah, so anyway, that's his story and a lot of ranting by me in between, but I'll put the link to this, if you are someone who suffers with mental health problems and you want more information about ketogenic therapies, and that Metabolic Mind is